Well, hello, everybody. I wanted to go through some statistics before I get started here. First off, I worked as a nurse for 42 years, and 23 and a half years of that time frame, I did work in a level 1 trauma center. Out of those 23 and a half years, 13 years were in a level 1 ED. And so when we look at statistics of sex trafficking, 97% of victims of sex trafficking have entered healthcare facilities at one time during their altercation. They will come in whether they have a urinary tract infection, whether they come in with abdominal discomfort or STD, or come in with even worse. Violence is a constant in the lives of girls and women in the sex trade. And 88% they come from 88% that come forward that are victims of exploitation, but there's only 6% of the healthcare that are really aware of the circumstances of what sex trafficking is all about. And this might be the one time her best chance to get any help. And unfortunately, however, her true needs are invisible to the systems. By the time a woman in the life needs medical attention, they have learned to use anger and denial as tools to survive. This invisibility is not surprising. She has a good reason not to tell anyone she's in the sex traffic trade. And in some cases, the traffickers might be sitting within arm's reach to protect their investment. Many of the exploiters will even force their victims to memorize a speech for medical staff. They're oftentimes like the females that come in at the bedside or who are alongside of these women are called the bottom bitch. And so they are usually controlled by the pimp, who then allows them to control the girl by giving them just enough love and compassion to continue to do the work that they need to do for the pimp. And so that bottom bitch tends to get the worst of the worst if things don't go well. She's the one who gets the worst of the beatings. Similar to victims of domestic violence, there's quite a stigma, there's a shame, and there's a fierce silence within her. And as a result of system failure, her non-medical needs for help, services, and disconnect from her pimp go unmet. And an opportunity for intervention is missed. Clothing, demeanor, race, gender expression should never, ever, ever alter our care and compassion for patients who come in amongst us. Change starts with each individual's looking at our own personal biases. And so I'm going to share a few stories tonight about being in the ER. It's been about five years now since I've been in a level 1 trauma center ER, but some of these stories still stand out today, how powerful. I had one night where I had a Hispanic mother come in. She had 3 young children under the age of 7, and she came in with a 19-year-old daughter. Her daughter was coming in with complaints of abdominal discomfort at that point. She seemed rather distraught. She had cognitive delay. She was also possibly autistic as well at that point, but she was really nonverbal, didn't speak. She hung her head very low. She didn't make any eye contact with me. I tried to find a moment to be able to try to engage with the mother. You want to develop a trust if you can in any way. At least that's my practice. And so, I fed the kids, got them something to eat, and then started asking her some questions about how she was doing as well as a mother. And then finally, after a while, she just basically, opened up her mouth and she said to me, "They come every few weeks to pick my daughter up, and she's gone for 2 or 3 days at a time." She stated that they threatened her and her family constantly if she would go to the authorities. And she says, "And I don't know what they do with my daughter or where they take her, but they always bring her back." And so in her fear and in her anxiety, I asked if we could connect and try to contact the authorities, and she refused. But you also have to look at, in situations with that, if you don't have a clear plan to protect that individual, leaving her and discharging her, coming upon the authorities may cause her a great deal of harm and maybe even having her children killed. But she might also have been a problem where she may not have been legally in the country either, so concerns that she might even have her own children taken away. So the fear factor was there. We ended up treating her daughter, and she cried, and I cried alongside of her, and discharged and went on with her life. So this is the plights that we see in an emergency room. Another case that I had that I really like to talk about is a situation where I had was getting an assignment, and they said, well, you know what, Laurie, we've got this. We're not sure what situation. A car had sped up at a very high rate of speed and came around our emergency room, and they threw this woman out of their vehicle, and she was shackled, both arms and legs with rope. And we retrieved her. She really didn't sustain any major injuries, but she definitely had a cognitive delay. And she really didn't understand at all where she was at. She had no idea what state she was in or where she was at all. We treated minor wounds on her, but at that point then we connected with social worker to determine that she needed some protective custody. So she was a vulnerable individual with a cognitive delay that ended up being trafficked. And so she was actually quite the sweet little gal. She loved me. She's like, let's dance, Laurie. And she'd want to dance with me, but you could tell her she was definitely had a delay, and so being vulnerable. But even with that, being vulnerable, other individuals that I saw, even in the emergency room, is another case of a vulnerable young girl who came in from a group home out of the Milwaukee region. And she came in, and her sister had brought her in because she had an STD. So why is this gal in a group home having an STD? So the sister said, you know what, I've connected and tried to connect with her multiple occasions, and they will not let me talk to her. And I've even come, and she's never even been around. So they're not sure what was going on. So the thing is a lot of these individuals in group homes have a state-appointed guardianship that doesn't take a whole lot to do. It's very easy to obtain a guardianship on somebody. And at that point, there was over 400 group homes that are already established in the Milwaukee region. So this individual, we contacted the guardian. He goes, she's fine where she's at. I want her to be kept where she's at. And so I brought it up to the doctor, and the doctor says, will you tell this gentleman that if he doesn't change the group home, or we cannot have the authority to change the group home, that we will be admitting her and we will be doing a major investigation. And so, well, of course, it didn't take much for him to say, oh, yeah, we'll move her, of course, because he was obviously hiding a lot of things that we didn't know. But she should have been brought in, really. She should have been brought in, but there's just not policies and procedures that are in place in a lot of the hospitals to be able to protect a lot of these victims coming in. One case that I had, and I like to talk about, is that I had a young Native American girl. She was in her mid-20s. She came into our emergency room. She was being treated with abdominal pain, and so we need to do a pelvic exam, which is a very invasive type of procedure. She came in with an African-American gentleman who was blacker than black, and said he was her daddy. I'm her dad, right? So, but anyway, we were able to get her alone. So the one thing you want to do is try to get them alone. Get them alone so you can ask them safety questions. And really, our emergency room safety questions right now were pretty lax. You feel safe in your home environment? Is there anybody hurting you or thinking of hurting yourself? They're super simple. And so we're trying to do more on policies on trying to get that more expanded. But anyway, we were able to get him to leave the room with a lot of animosity towards us. And so me doing a lot of education, people in the emergency room would say, come on, they'd come and ask me my advice. Laurie, what do you think? This is just this doesn't pan out, and if your gut feeling is in there, you need to act in your instinct. And so lo and behold, I said, you need to ask her these safety questions. They did it, and she denied that she was in an unsafe environment. She denied that anybody was hurting her. And so in the meantime, he was just a pistol out in our waiting room. He was pacing the floor on his phone, coming up to us, swearing at us, he was just nasty, actually even getting in front of our security officers as well. And one time he tried to get back into the room, which is the door opened, and he tried to get back there. So we knew that whatever he's hiding, this is his commodity, if you want to call it as such. And he was trying to, and he knew we had some heads up on what was going on. So they asked me, Laurie, could you go talk to her? And I did talk with her. And you got to gain a trust with individuals like that if you are they got to really know that you do have a compassion for what they're going through. And she denied that she was unsafe. And so we ended up having to give her some information. Sometimes what we would do is we'd take lipstick tubes, if you ever, like a lipstick tube, and we had to have rolled up information for them so we can get that. So any discharge paperwork, we didn't want to indicate anything that would make her in an unsafe situation when she's discharged with her pimp. And so, or somebody who might be hurting her. Even worse when it comes down to when she's discharged. So she was discharged, we gave her the resources, and then later on he called me and he called asking for me, and he was just nasty on the phone. Called me every word in the book. And so, you know, trying to threaten me in my own way, but that's okay. But these are kind of some of the situations when you don't have specific policies in place within your own healthcare environment. The statistics state that a study in 4 sites of the United States and Canada found that 40% of sex trafficking survivors were identified as Native Americans or First Nation. In Seattle, Washington, 94% of Native American women in a study were forced or coerced in some time into the sex trade in their lifetime. And in Minnesota, 39% of interviewed Native American women entered into prostitution before the age of 18, which is legally defined as human trafficking, anything under the age of 18. And so I was talking to a group, and they told me that, you know what, we teach and train these young girls, Native American girls, at a very young age, and we educate them on rape. And it's not a preventative, but it's when it happens and they are raped, what they're going to do with their next steps. So it's a very vulnerable group we really need to be praying for as a Native American group. My last story that I wanted to share with you was a story that actually kind of changed my life. Although I've had a lot of stories, but this one specifically, I was coming in on working a shift on a Sunday morning, and I was in another department trying to make sure the flow of the department kept going so we didn't back up into our waiting room. And so we had this young 16-year-old come in, and she was pregnant. And I thought, well, this will be an easy case. She's with her mom. We'll be able to treat her, and she'll be able to be discharged. But then when I grabbed her chart and tried to evaluate it, all over the chart it was that concerns for sex abuse, concerns for human trafficking, over and over from multiple hospitals within the city. It made me... And so, okay, of course it's a red flag. You know what, thank God I was able to read that chart. Not always were we able to get time to read every portion of the chart. So I flagged down the doctor, the nurse practitioner, as well as the primary nurse who was taking care of her, that we needed to have a plan in place to be able to do something about this situation. So we ended up getting her, she came in with another African-American gal, she said it was her mother. But this little girl was full of rage. She was full of anger, and she paced the floors, and she swore everything in the book at us. And it was so difficult. We couldn't get the woman out of the room, so we couldn't really get and ask safety questions individually on her. And so the plan came forward trying to get her alone, trying to gain her trust. And also whenever anybody's under the age of 18, it's illegal to have sex. And so, but there's also emancipation when a gal comes in and they're pregnant. They actually are protected by the law where we don't have to call their parents because they come in and they're pregnant. So, and she was also at this point saying this was her mother. So at that point, we ended up, had the doctors to try to do a physical exam on her to make sure. But this little girl was full of bruises. This little girl had a black eye. So first things we do is we call Child Protective Services. So they were contacted immediately, and our social worker within our department. So at this point, we wanted to get her alone. We wanted to ask safety questions. She just wouldn't cooperate with us much at all. She was very angry, and this other woman just sat in the corner. So we ended up, I got snagged into another area of the department. The primary doctor and the physicians and nurse practitioner had to manage this, and they ended up not doing much. CPS never came through, and the social worker got flagged alongside of a trauma in the department, and so they ended up discharging this little girl with this individual. And I was angry, really angry when I found out about it because I was busy, and finally I said, you know what, I had another social worker look up the situation and do more research on her. And she came in later on and she said She came up to me towards the end of my shift, and she said, you know what, Laurie, don't ever change who you are. She was on the missing and exploited child's list, and we missed her. So at that point, I was so angry, I was so mad. I walked out of the trauma room, and I just started screaming at God. Why, God? Why did you put this situation in? And all I could think about is this little girl peeking around the corner, and we had one chance to save her life. And so you get bitter or you get better, right? And I'm a lion, and so I got better. Absolutely, I did. I was mad. And so within less than 2 weeks, we started a human trafficking task force at our Level 1 Trauma Center that's never had it before. I had 35 people involved in this. I got yanked in the office, and my director said, Laurie, what are you doing? You can't just start any organization you want. I said, you know what? I am. And they said, you know what? You're doing right. I said, get me leadership. And they got me leadership. And so for a year and a half, we did education, awareness of every ER, a nurse, doctors, social workers, receptionists, security officers, and we did grand rounds for our doctors. We blew it out of the wall so that we could have that education and awareness come forward. And in the meantime, this is just how God works. His timing is always impeccable in so many ways. We ended up having to work with Dr. Angela Rabbit. She's over at Children's Hospital. She had just implemented all the practices for children in sex trafficking. And so I called her, and we had a talk. She said, Laurie, I just got grant funding for the adult population. And so we blew out HCAS, which HCAS is Healthcare Collaborative Against Sex Trafficking. We're on our 4th year. You take a look at our website. We've got policies and procedures in place to help prevent this ever to happen again, so that we can protect these young children and these young women who want to come out with legal resources, shelter, food, everything. To take a look at its HCAS. And so in the midst of all of this, we have everybody needs to keep their eyes open. There's more that you see under there, and they're not going to come right out and say, I am being sex trafficked. So look for those. And I had one individual who found one and saw somebody getting her nails done. And it was a young girl after we had done training, and she came up to me and told my story. This individual did not, usually you're happy about getting your nails done, right? Most people are. But she hung her head low, and you could tell she felt sense that something wasn't right. And she walked out after she got hers done, and then she walked back, and she talked to this young girl. And she says, you know what? They're waiting for me right out the door when I'm done. And so in the meantime, she connected with the police, got her in the front of the door, and left with the police, and they were able to apprehend her perpetrator at that point. But keep your eyes out. It's in every area. It's all around us. So just wanted to share a few stories. Thank you for everybody coming out.